Muscarinic antagonists. Muscarinic antagonists are drugs that usually inhibit the outflow of the parasympathetic pathway. They are also called anticholinergic drugs because they block the activity of the muscarinic acetylcholine receptor. Atropine, homatropine, and tropicamide are all available as eye drops so that your optometrist can temporarily paralyze your ciliary and pupillary sphincter muscles via M3 receptors. Do you remember from our cholinomimetics lecture the action of the ciliary muscle? That's right, it aids in accommodation, aka near vision. Therefore, paralysis of the ciliary muscle would result in loss of accommodation and therefore blurry vision. Paralysis of the sphincter muscle results in huge pupils, which we call mydriasis. Scopolamine and benztropine are M1 muscarinic antagonists. Scopolamine is a classic antiemetic drug used as a patch that you can stick on a patient who has trouble with nausea. Benztropine antagonizes muscarinic receptors within the basal ganglia and is therefore helpful in the treatment of Parkinson's disease. Thinking back to your neuro chapter, what neurotransmitter changes are seen in a patient with Parkinson's disease? That's right, decreased dopamine and increased acetylcholine. That's why we give benztropine to curb the excess cholinergic activity. Now, benztropine can also be used in the treatment of acute dystonia. Do you remember from your psych chapter and what group of patients would you expect to see acute dystonia? Acute dystonia occurs due to excess dopamine antagonism and therefore could be seen in patients taking antipsychotics. For all you future anesthesiologists, glycopyrrolate is used to prevent bronchial secretions when trying to intubate a patient preoperatively. It is much easier to see the airway without a bunch of wet secretions in the throat. Hyoscyamine and dicyclomine antagonize cholinergic receptors of intestinal smooth muscle. This is great for a patient with hyperactive intestinal contractions, such as in an irritable bowel syndrome. Ipratropium and tiotropium are high yield because these are inhalation treatments that COPD and asthma patients receive. They decrease bronchial smooth muscle tone, making it easier to breathe. Oxybutynin, sulfonacin, and tolterodine block muscarinic receptors on the detrusor muscle of the bladder. Antagonism of muscarinic receptors on the detrusor muscle prevent it from contracting, and therefore you cannot push urine out. This is great when you're treating an overactive bladder,